Have you ever felt like you've tried everything, like dieting, exercising lightly, taking medication regularly, but still can't control your blood sugar, cholesterol, and expanding waistline? You're not alone. According to a recent survey from the U.S. National Institute on Aging, up to 70% of people over 60 are facing at least two of the following three health conditions at the same time: diabetes, high cholesterol, and abdominal fat. This not only reduces the quality of life, but also increases the risk of death from stroke or heart attack. But there's good news. Some natural foods have been proven to effectively reverse or control all three of these problems if you use them correctly and regularly. Not strange or hard to find foods, but familiar dishes recommended by endocrinologists and nutritionists. 1. Green beans, the silent enemy of blood sugar. We found that patients who regularly ate legumes, especially green beans, had more stable blood sugar levels, with a significant reduction in A1C after 3 months, said Dr. Emily Watson, an endocrinologist at Johns Hopkins University. Green beans contain large amounts of soluble fiber and resistant starch compounds, which help slow down the digestion and absorption of glucose. This not only helps diabetics control their blood sugar levels, but also creates a feeling of fullness for a long time, reducing hunger due to low blood sugar. Advice from a long-lived person. James Miller, 92 years old, living in Florida, said he ate steamed green beans 3 times a week since he was 60 after being diagnosed with prediabetes. The result? He has never had to take insulin. 2. Avocado. Not all fats are bad. You may have heard that avocados are fat and should be avoided. The truth: avocados contain monounsaturated fat, a healthy form of fat that can lower LDL cholesterol and increase HDL. A 2021 study from the American Heart Association found that older adults who ate half an avocado a day had significantly lower cholesterol levels than those who didn't. Avocados also contain a large amount of potassium, which helps control blood pressure and reduces the risk of belly fat accumulation, a risk factor for type 2 diabetes and cardiovascular disease. Note: don't eat more than 1 avocado a day. Eat it with salad or use it in a sugar-free smoothie. 3. Chia seeds, a small but heavyweight type of seed in terms of effectiveness. You may not have noticed it, but chia seeds are one of the top foods recommended by nutritionists for older adults with metabolic diseases. With just 2 tablespoons of chia seeds a day, you will receive nearly 10 grams of fiber, a high amount of plant omega-3s. Antioxidants help prevent inflammation. According to Dr. Mark Reynolds, a clinical nutritionist in California, I have seen many patients lose significant belly fat and improve blood sugar after maintaining chia seed supplementation every morning with almond milk or oats. A study in Canada showed that after 6 weeks of eating chia seeds, 60% of participants lost an average of 3 centimeters in waist circumference without changing their exercise regimen. Stop for a moment to ask yourself, have you accidentally skipped these valuable foods just because you are afraid of fat or do not like the taste? Remember, eating less is not eating right. Eating right helps you live a healthy life. Dr. Karen Mitchell, an endocrinologist in Chicago, sighed, "We see significant improvement in patients just by changing their daily diet without increasing their medication dose." 4. Cinnamon, a spice but as effective as a treatment drug. You may have added a little cinnamon to your morning cereal or baked goods, but few people know that cinnamon actually has the ability to stabilize blood sugar and significantly reduce LDL cholesterol. A 2020 study by George Washington University showed that people who consumed 1 teaspoon of cinnamon every day for 3 months reduced their fasting blood sugar by 10 to 12%. LDL cholesterol also decreased by an average of 8 to 10%. Cinnamon works by slowing the emptying of the stomach and increasing the sensitivity of cells to insulin, which is extremely important for people with prediabetes and type 2 diabetes. How to use: sprinkle on oatmeal, smoothies, or mix with warm water after breakfast. 5. Salmon, a golden food for people over 60. No one is surprised that salmon is on this list. But what many people don't really take full advantage of is, salmon is not only good for the heart, but also helps destroy belly fat and control blood sugar in a powerful way. Why? Because salmon is rich in omega-3, EPA, and DHA, two fatty acids that help reduce inflammation, a key factor in insulin resistance. Lower triglycerides, a type of blood fat linked to stroke and diabetes. Inhibit visceral fat accumulation. We recommend that older adults eat fatty fish like salmon at least twice a week, says Dr. Daniel Brooks from the Mayo Clinic. After just 6 to 8 weeks, many patients reduce both visceral fat and fasting blood sugar levels. Note: eat salmon grilled, steamed, or pan-fried. Avoid deep frying. 6. EGGS, misunderstood for decades. Surprised? For decades, eggs were considered the culprit of high cholesterol. But recent studies have exonerated this nutritious food. A 2019 Harvard University study found that people who ate one egg a day did not have a higher risk of increased LDL cholesterol, but instead improved good cholesterol and reduced uncontrollable cravings. Egg yolks contain choline, a substance that supports liver function and reduces blood lipids. Meanwhile, egg whites are a clean source of protein that helps stabilize insulin levels. Betty Sanders, 68 years old, had eliminated eggs from her breakfast for 20 years because she was afraid of cholesterol. After being advised by her doctor to eat them again, the results of her blood tests after 3 months surprised her. HDL increased by 15%, LDL decreased slightly. Belly fat shrank significantly without changing physical activity. It's worth thinking about. Many seniors are cutting out fats or carbs entirely, not realizing that the problem isn't the food group, but the food type. Salmon, eggs, or cinnamon, all of which were once considered suspect, but have now been proven to be extremely beneficial. At age 60 and older, your body no longer processes food the same way it did at age 30. The same dish, but the insulin response, the rate of burning calories, and the ability to control cholesterol, all change. That's why choosing the right food is one of the most powerful weapons to fight diabetes, blood fat, and belly fat. Here are the next 3 foods, once underestimated, but doctors now consider natural medicine. 7. Spinach, the leafy green vegetable that cleans blood vessels. Do you think spinach is too simple? But this leafy green contains a rare combination of magnesium, potassium, iron, and natural nitrates, all of which are essential for lowering blood pressure, reducing insulin resistance, and dilating blood vessel walls, increasing circulation, and reducing fat accumulation around organs. We found that patients who added spinach to their diets 4 to 5 times a week had improved blood lipids after just 1 to 2 months, says Helen Gray, Ph.D., a cardiovascular nutritionist in California. In particular, the nitrates in spinach increase the flexibility of arteries in older adults. Tip: lightly sauté with olive oil, toss in salads, or cook soup with fresh ginger. Don't overcook to preserve nutrients. 8. Whole grain oats, not just a Dieter's breakfast. Sounds boring, unsweetened, and tasteless? But for diabetes doctors, this is one of the top recommended foods for people over 60. Why? Because oats are rich in beta-glucan, a soluble fiber that has the following effects: lowering postprandial blood sugar, reducing intestinal cholesterol absorption, increasing satiety, helping the elderly control weight and visceral fat. Research at Tufts University shows that people who eat oatmeal every morning 5 days a week have 12% lower LDL cholesterol and a significant reduction in insulin resistance. 73-year-old Ronald Harris switched from white bread to oatmeal after his doctor's advice. After 6 months, the results were A1C decreased from 7.1 to 6.4. Waist circumference decreased by 2 inches, and no more cravings for sweets at night. 9. Cucumber, a surprisingly effective snack. Cucumbers are often overlooked in a healthy diet, but that's a mistake. This is a food with almost 0 calories, but contains silica, which helps improve tissue elasticity, water, which helps eliminate excess sugar and toxins, and flavonoids, which reduce inflammation and stabilize glucose. I recommend that diabetics or people with belly fat eat cucumbers every day, in salads or juiced between meals, says Dr. Rachel Gomes of the Chicago Endocrinology Center. The surprising results come from the simplicity. A 2022 survey showed that people who added cucumbers to their diet lost an average of 1.5 centimeters around their waist after 8 weeks, simply because it reduced overall food intake and increased detoxification. Note: avoid eating with salt or salty sauces to avoid affecting blood pressure. What you need to remember: not all expensive or strange foods are miracle drugs. Even familiar foods like oatmeal, green vegetables, or cucumbers, if used properly, have the ability to regulate biological indicators more powerfully than any pill. 10. Garlic, a simple bulb with comprehensive disease-fighting power. It is not an exaggeration to call garlic a superfood. Not only because garlic contains natural anti-inflammatory substances, but also because of the effects proven through many studies. Reduce LDL cholesterol. A study at UCLA showed that regular garlic supplementation for 12 weeks helps lower LDL by an average of 10%. Improve insulin sensitivity. Garlic increases the ability of cells to receive insulin, helping to reduce blood sugar without increasing the dose of medication. Prevent visceral fat accumulation. Antioxidants in garlic prevent fat from wrapping around the liver and pancreas, the origin of diabetes and heart disease. Dr. Melissa Hughes, a senior internal medicine specialist in Texas, commented, "Garlic is not just a spice. For people over 60, it is a medicine that supports circulation, fights blood fat, and protects the pancreas." How to use correctly. Use fresh crushed garlic. Let it sit for 10 minutes before cooking to form the active ingredient allicin. You can use 1 to 2 cloves per day in stir-fries, soups, salads, or soaked in apple cider vinegar. Avoid burning or frying for too long because it will lose the active ingredient. 11. Blueberries, small fruit, big effect. Blueberries have the effect of improving insulin sensitivity, reducing systemic inflammation, supporting visceral fat loss. 2013 research. Harvard University announced people who eat 3 servings of blueberries per week have a 26% lower risk of type 2 diabetes. How to use. Eat fresh every morning. 1/2 cup is enough. Mix with oatmeal, unsweetened yogurt. Make a smoothie with chia seeds and kale. Note: avoid frozen blueberries with added sugar. 12. Almonds, small but full of positive energy. Main effects: lowers postprandial blood sugar, increases good cholesterol, controls appetite. A study at the University of Toronto found that people who ate a handful of almonds a day reduced postprandial blood sugar and HbA1c levels in 12 weeks. How to use. Eat between breakfast and lunch. Mix into Greek yogurt or salad. No frying, no salt. Recommendation: 6 to 10 nuts a day is enough for the elderly. 13. Turmeric, traditional spice, modern effectiveness. Turmeric has the following effects: anti-inflammatory, antioxidant, improves insulin resistance, supports liver fat reduction. A clinical trial in India showed that curcumin reduced fasting blood sugar and blood lipids in elderly people with prediabetes after 8 weeks. How to use. Mix 1/4 teaspoon of turmeric powder every day. Cook with soup, broth, or drink with almond milk. Add black pepper to increase curcumin absorption 20 times. 14. Apple fruit every day keeps the doctor away. Main effects: reduce bad cholesterol thanks to soluble fiber pectin. Stabilize blood sugar thanks to flavonoids. Support the digestive system and liver. Research published by the Nutrition Journal magazine. People who eat at least one apple, they have lower LDL levels and smaller waistlines. How to use: eat the whole peel. Choose green or fresh red apples. No pulp. Do not squeeze into juice. 15. Apple cider vinegar, weak acid, strong effect. Apple cider vinegar has the following effects: lower blood sugar after eating, reduce sugar cravings, enhance digestion and absorption. A study from Arizona State University shows drinking 2 tablespoons of diluted apple cider vinegar before dinner helps people with prediabetes reduce blood sugar after meals by 34%. How to use: 1 to 2 tablespoons of apple cider vinegar plus 1 cup of warm water. Drink before main meals. You can add a few slices of lemon or cucumber if it is difficult to drink. Note: do not drink pure. Do not drink on an empty stomach if you have stomach ulcers. 16. Lentils, a reliable vegetable protein. Main effects: reduce blood sugar after meals, increase soluble fiber, reduce cholesterol, and support liver fat loss. Research from the University of Guelph proves replacing 50% of white rice with lentils helps reduce blood sugar after meals by 20%. How to use: cook soup, stew until soft, mix salad. Combine green vegetables and olive oil to increase effectiveness. Suitable for the elderly who have difficulty chewing, have lost teeth. 17. Kale, vegetable of the 21st century. Kale is rich in vitamin K-C, lutein, has the effect of reducing blood vessel inflammation, lowering blood lipids, increasing liver function. A study from Korea showed that after 12 weeks of eating kale daily, total cholesterol levels decreased significantly, while HDL increased slightly. How to use: mix salad. Quickly stir-fry or steam with olive oil. Make a green smoothie combined with apples and chia seeds. 18. Unsweetened Greek yogurt. Main effects: provides probiotics to help improve the intestines, stabilize weight and reduce belly fat, support digestion for the elderly. A study in Spain showed that people who eat Greek yogurt every day have a 20% lower rate of belly fat than the group that does not eat it. How to use: eat in the morning or after main meals. Can be mixed with chia seeds, blueberries, or cinnamon. 19. Green tea, the body transforming drink from the inside out. Main effects: burns belly fat, reduces LDL cholesterol, supports blood sugar control. A report published in the American Journal of Clinical Nutrition in 2015 showed that people who drank 2 to 3 cups of green tea a day significantly reduced visceral fat after just 12 weeks. Key active ingredient: epigallocatechin gallate, a powerful antioxidant that boosts metabolism and improves blood vessel function. How to use: drink warm tea 30 to 60 minutes after meals. No added sugar. Do not drink on an empty stomach or close to bedtime. 20. Red bell pepper, rich in vitamin C, prevents fat accumulation. Bell pepper has the following effects: powerful antioxidant, reduces cortisol, the hormone that causes belly fat accumulation, provides fiber, helps you feel full longer, and stabilizes blood sugar. A 2018 study in Thailand found that people who added bell peppers to their main meals had more stable insulin levels and fewer sugar cravings in the evening. How to use: eat raw with salad, stir-fried with green vegetables, grill with salmon or eggs. Summary of the list of 20 foods that should be in the elderly's diet. Anti-diabetes food group. Typical examples are cinnamon, blueberries, oats, green beans. Lower bad cholesterol food group. Typical examples are salmon, eggs, apples, turmeric. Lower belly fat food group. Typical examples are chia seeds, green tea, apple cider vinegar, kale. Lower inflammation food group. Typical examples are garlic, red bell peppers, spinach, lentils. Food groups increase satiety, control weight. Typical examples are avocado, almonds, Greek yogurt, cucumber. Real story. Recovered at age 85 without medication. Franklin Adams, living in Colorado, used to be an elderly man with a typical medical profile. Fasting blood sugar, 140 milligrams DL. Total cholesterol, 240 milligrams DL. Waist circumference, 106 centimeters, and was taking 4 types of medicine every day. But after being advised by a nutritionist to switch to a new diet containing the foods mentioned in this video, he started to change little by little. After only 4 months, blood sugar dropped to 102. HDL increased, LDL decreased, waist circumference decreased by nearly 10 centimeters. And the most remarkable thing, his doctor gradually reduced the medications. By the 6th month, he was only maintaining 1 aspirin for prevention. Franklin shares, "I don't follow a strict regime. I just eat more beans, fish, oats, garlic, and green vegetables. My body does the rest." Conclusion. Change your meals. Change your life. Don't let medicine be the only option. When you understand that food can be the most powerful medicine, you will look at every meal with a different respect. As long as you maintain a smart diet, combined with gentle exercise and stable sleep, your body, even in your 70s or 80s, can recover in an amazing way. And as Dr. Corinne Mitchell once said, it's never too late to start eating right. But the earlier you start, the better the results. Which foods on this list do you find the easiest to apply? Have you tried them? Share in the comments. And if you find it useful, don't forget to send this video to your loved ones so they can also start their journey to a healthy life from today's meal. Q&A with doctors. Decoding misunderstandings about nutrition and old age. Question 1. Should the elderly avoid all fat to reduce blood fat and belly fat? Answer. No. This is a common misconception. Your body still needs fat, but it is good fat such as monounsaturated fatty acids, omega-3. Good fats do not make you fat, but on the contrary, help reduce inflammation, support sugar and cholesterol metabolism. Question 2. Should people with diabetes completely avoid fruits and starches? Answer. Not necessarily. The problem is not the starch or natural sugar, but the amount and type of food eaten. For example, whole grain oats have a low GI, which is good for diabetics. Fruits such as blueberries, apples, or grapefruit are high in fiber, which does not cause blood sugar spikes. Avoid dried fruit, canned juices, white bread. Question 3. Can eating right replace medication? Answer. In many cases, eating right does not completely replace medication, but it helps reduce dosage, reduce dependence, and sometimes stop medication altogether when combined with regular exercise and monitoring. Doctors recommend use food as medicine before you are forced to use medicine as food. Question 4. I eat healthy. Why can't I lose belly fat or lower my blood sugar? Answer. It could be because you eat too little protein or good fats, which makes you hungry and prone to snacking. You lack sleep or are stressed, which disrupts insulin and cortisol hormones. You still eat healthy disguised foods like sugary cereals, flavored yogurts, and fruit juices. Solution. Keep a 7-day food diary. Prioritize whole, minimally processed foods. Increase green vegetables and foods rich in fiber. Walk 15 to 20 minutes after main meals. Question 5. Is there any way for the elderly to use the above foods if they have weak teeth and have poor appetite? Answer. Yes. Here are some tips suggested by doctors and experts. Make a smoothie with avocado, chia seeds, oats, and a little banana, which is easy to drink and nutritious. Salmon and spinach soup, easy to swallow, rich in omega-3 and nitrates. Steamed garlic crushed with green beans aids digestion and reduces blood fat. Cook vegetables with bone broth, more delicious, retain nutrition. The final message: small changes will make big changes. You don't need to change everything in one day. Just add one healthy dish to each meal, cut one harmful dish from the table, and maintain it. Endocrinologist Emily Watson emphasized, most older patients don't need miracles. They just need to persevere with what is simple, regular, and right. The final message: you don't need an extreme diet. You just need to understand which foods help you live well, control your disease while still eating deliciously, without restraint. Always remember that there is no pill as powerful as a proper diet. Choose at least 3 foods from the above list to include in your daily meals. Comment below which one you like best and which recipe you would like me to suggest. Please share this video with your loved ones, because who knows, you might just add precious years to their lives. See you in the next videos, where aging health is no longer a mystery, but a proactive, empowering, and worthwhile journey.